So today we're going to go over medication administration. One of the most important things in medication administration is that there are 7 rights for it. There is the right patient, the right medication, the right route, the right time, the right technique, the right dose, and at the end, the right documentation. So one of the very first things I'm going to do is I'm going to go overhead and I'm going to verify my physician's orders with my MAR sheet so I can make sure that I can see if I can use my MAR sheet or if there's any changes or anything that I need to go over again. One of the first things I would also do is I want to make sure that the patient on my MAR sheet and the patient on my physician's orders are the same, just so there's no mix-up and I'm not giving the right patient the right medication. Alright, so I'm going to go write on down my physician's orders. So I see morphine sulfate, 15 milligrams IM stat, and morphine sulfate, 15 milligrams IM stat. I'm going to go ahead and make a little mark next to each of them so I know that they have been verified and that I can go ahead and give it to my patient once I've got it all correct. I have ampicillin 375 milligrams IM now, repeat dose in 6 hours. And I have ampicillin IM 375 milligrams, repeat dose in 6 hours now. Okay. I have Lanoxin 0.125 milligrams PO every day. And then I have Lanoxin 0.125 milligrams PO every day. I have an NPH insulin 16 units and regular insulin 9 units, subcutaneous AC. And then over here I also have an NPH insulin 16 units and regular insulin 9 units, subcutaneous AC. I have a Prevental 2 puffs every 4 hours while awake, and Prevental 2 puffs every 4 hours while awake. I have an acetaminophen elixir 650 milligrams PO every 4 hours as needed for a temperature greater than 101 degrees Fahrenheit. And I have acetaminophen elixir 650 milligrams PO every 4 hours as needed for a temperature greater than 101 degrees Fahrenheit. Alright, let's see, I also have a tuberculosis test with 0.1 milliliters ID now, and I have a tuberculosis test, 0.1 milliliters ID now. Alright, perfect. So I have verified my MAR sheet, my physician's orders, so I can go ahead and use my MAR sheet to go ahead and get all my medications ready and when I get ready to administer. Alright, so I would also have by this time gone ahead and went and checked my, completed my medication worksheet, make sure that all the medications that I'm about to give to my patient are appropriate and that nothing is going to affect them in a negative way that could harm them further, and also to verify that it is the correct patient and these are appropriate doses. If there was something wrong or something that looked out of place, I could go ahead and call my physician and verify his order. So at this point I'm going to go ahead and I'm going to verify that I have all the right medications out, so make sure I can have everything all ready. So I have my morphine sulfate, and the morphine sulfate I have both in right here and in one of these. So I have an ampule and I have a Carcujet, so I could use either one. Let's see. Then I have ampicillin, and so ampicillin I have in the powder form, so I will need to add some water to it, sterile water. So I have both of these. Both of them, their expiration dates are good. So they are current and they will be okay to use when I go to reconstitute them. The expiration dates on my morphine also is correct. I have a TB test. A TB test, do I have enough in here? I seem to have enough of the other ones, and this one does have, the expiration date is good. Next we have our Lanoxin. So I have that little pill right here. I can see the amount on it. I can also verify that we have that the expiration date is current and it will be okay to give safe to my patient. Alright, next we have the insulin. So I have my NPH insulin and I have my regular insulin. I can see by them that they are both current, the expiration date on them is okay, and that I will have enough in each of these to go ahead and administer to my patient when the time comes. Next we have Preventnol, so I'm going to go ahead and check. So I can see my Preventnol is current, and I can see the correct amount in here, and it is good to go to give to my patient. And then finally we have our acetaminophen. So here we have our acetaminophen. The bottle indicates that the expiration date is current and it will be okay. Also that I have plenty in here, enough to give to my patient. Alright. And then normally one of the first things you would do is go ahead and start with your stat and now medications, because they do have a time constriction on how long it takes before you can give them to your patient and how long they will last. But for today's purposes of the video, I am going to do my non-injectables first. So right now I'm going to go ahead and wash my hands and put my gloves on. So before I went and checked my hands, what I did with all my medication was just do my first check to make sure I had the right medications and that they were all safe to give to my patient, and that they didn't have all their expiration dates are good. Nothing's expired and they're all going to be safe. Alright, so because I'm going to do my non-injectables first, I'm going to go ahead and I'm just going to go over, go in order here on my sheet, and then do any calculations that I need to do here. So I'm going to go ahead and I'm going to start with my Lanoxin. So I can see here that my tablet that I have is, I'm going to have to do a calculation because my tablet is 0.25 milligrams, and what I'm going to need is 0.125 milligrams. So I need 0.125 milligrams, and what I have is 0.25 milligrams in one tablet. Alright, so that to so that is going to equal to 1/2 of a tablet. And then I'm going to go here and verify my info with. Alright, so I double checked with my nurse. They saw that I did this. At this point I'm going to go ahead and I'm going to open up medication. I have also already checked in my drug book and verified that this pill can be crushed and it can be cut, so it will be safe to do that. So I'm going to go ahead and get this here. I'm going to have my assistant open this for me real fast. So I'm just going to do a quick clean out here just so we can make sure that we don't get any extra medications or contamination. And then just do a wipe through here just to make sure that it's clean, and then this will go into the trash. Alright, so I'm going to go ahead, I'm going to place this in here, and I'm going to try and line up all the score marks correctly. There we go. Okay, go ahead and just do a quick cut. Alright. And then I'm going to go ahead and I'm going to place the pill in here, and I'm going to put it in here so I can remember to double check before I give it to my patient, so that I can make sure that I double check their apical pulse, because this can affect their heart rate. So I am going to, because I can verify that it can be crushed, I'm going to go ahead and crush this in between 2 cups, just to kind of make it a little easier. Alright. And there we have our pill nice and crushed. I'm going to go ahead and put this in there with it, so I can remember to go ahead and check my patient's apical pulse before I give it to them. So there's that. And then normally I would probably also go ahead and put the other half of the pill in another container and take it in there with it, so that if there is a problem or if I drop it or something weird happens, then I have another one there to give my patient. So up next we have the Proventanol. And so I did my second double check. I made sure that it was the right medication. I verified on the thing, and then I made sure that, and before I gave it to my patient, I would once again make sure that, and show the nurse, and so my nurse assistant saw me put it in there. Alright, so I'm going to double check to make sure my Proventanol. Do my second check real fast. Alright, go ahead and do that. Shake it 5 to 6 times just to make sure it's good and mixed up. Alright, so we're going to just open it, and then I'm going to go ahead and I'm going to attach it here. So what we're going to do here is we're going to have the patient go ahead and do a nice big exhale before they go ahead and take it. Take the cap off, of course. Do a nice big exhale, create a nice tight seal here with their lips, and then go ahead and take a nice deep breath as they push this and inhale it in. So they can get it all down into the bases of their lungs and make sure they really get the full effect of the medication. I would then wait a full minute and then go ahead and let them and do it once more, because it has to be done twice. Alright, so we did that, we've done that one. Alright, and so now I'm going to do my acetaminophen. So my order calls for 650 milligrams every 4 hours as needed. So what I have here is 325 milligrams per every 5 milliliters. So I'm going to go ahead and do a little calculation here. I need 650 milligrams. What I have is 325 milligrams for every 5 milliliters of our liquid here. So we have there. I'm going to go ahead and grab a calculator real fast for this one. I'm going to show my assistant here. I can't find a regular calculator, so I'm just going to use the one on my phone. I'm going to turn so that she can see the whole time that I'm just using the calculator portion of my phone. So calculator. So according to this, I'm going to need to do 650 times 5, and then divided by 325. So I'm going to need to give my patient 10 milliliters of medication, and she can go ahead and verify that. Looks good. Okay, perfect. At this point, I'm going to go ahead and put that away. So 10 milliliters. So I have a little cup here, so I can go ahead and you can clearly see right here on the side. You can see that it has the milliliters measurement. So I'm going to go ahead and set this on a flat surface. Open this up. I have verified once again that the expiration date is good. My assistant has also seen, my other nurse has also seen that that is correct as well. So I'm going to go ahead and pour this into the meniscus. Perfect. Alright. So I have that done. At this point, if I was just going to go in and administer these ones, I would take my little tray in with my medications into my patient's room. I would come on in and say, "Hi ma'am, how are you doing today? My name's Cassidy, I'm going to be your nurse. Are you Miss Moxie Java?" Perfect. Can you go ahead and give me your full name and your birth date? Alright. I verified her in for her that she is who I need to be giving my medications to. I'll go ahead and take all of her vital signs just as good measure, good part of the nursing process. And then I'm going to be giving her the Lanoxin. So I'm going to need to take her apical pulse for a full minute to make sure that her heart rate isn't too low, so that it's not going to affect her and cause serious problems. All right, ma'am, so I'm going to have to go ahead. I'm going to take your apical pulse. So I'm going to just uncover you a little bit, and I'm going to go ahead and I'm just going to listen to your heart. It's just going to be down here, okay? So I'm going to have to uncover you a little bit. I'll keep you as covered up as possible, I promise. Okay. All right, so I would go ahead, take this, and then I would find the 5th intercostal space, mid-clavicular line. Go ahead and listen to her apical pulse, and I would do so for a full minute to verify that I have the correct heartbeat and everything. All right, and at that point I would go ahead and administer all of her medications that were pertinent at this time and make sure that she was doing okay.